Survival from cardiac arrest requires quick recognition, rapid response, early defibrillation, and ACLS intervention. Understanding the operation of your ZOLL E-Series before you encounter an emergency situation will enhance your potential to save victims of cardiac arrest. The E-Series roll cage and bags work together to provide superior cable management options. The bags are part of the roll cage. The right-hand bag accommodates the sensor cables, each one routed through the bag. Each bag snaps into place, making assembly quick and easy for you. The left-hand bag accommodates either the 3, 5, or 12-lead ECG cables. The rear bag accommodates the spare battery. The top pouch attaches to the designated snaps and contains the multifunction electrode pads and cable. If using paddles, these slide into the paddle wells on each side of the roll cage. The EasyRead Tri-Mode display provides maximum readability, whether in pitch dark or direct sunlight. To toggle the display from color to black on white and to white on black, press and hold the contrast button. You should review the E-Series in-service CD, DVD, or VHS for basic operation, for manual defibrillation with advisory function, AED with manual override function, and for correct electrode placement. Before placing your E-Series in service, you should review the operator's guide for complete operating instructions. This program introduces you to the ZOLL E-Series with monitoring parameters such as pulse oximetry, 12-lead ECG, capnography, and non-invasive blood pressure. The E-Series defibrillator default settings are 120 joules, 150 joules, and 200 joules. These are completely user-configurable to meet the changing demands of EMS. If your medical protocols allow, you may select any of the energy levels using the Energy Select Up or Down arrow buttons. The new energy level will display on the E-Series monitor. An available configuration option will allow for the delivery of single shocks with CPR in between, as per the 2005 AHA guidelines. You should consult your medical control authority to confirm your recommended biphasic settings. The E-Series uses both sealed lead-acid or lithium-ion batteries. New, fully charged sealed lead-acid batteries offer up to 2.5 hours of ECG monitoring time. New, fully charged lithium-ion batteries will offer up to 4 hours of ECG monitoring time. The indicator gauge on the top of the batteries shows you how much runtime is left. Additionally, for the lithium-ion batteries, this gauge is located on the top right of the E-Series. Both batteries can be charged in the E-Series unit. The sealed lead-acid batteries can be charged in the 4x4 charger. Both lithium-ion batteries and sealed lead-acid batteries can also be charged in the Sure Power battery charger. When the E-Series detects a low battery condition, the low battery message is shown on the display. A 2-beep audio low battery tone is heard either once every minute or once every 5 minutes, depending on how your E-Series has been configured. As batteries age, the runtime between the low battery message and the defibrillator shutdown will decrease. It is recommended that when the low battery message warning appears, a fully charged battery pack be installed as soon as possible. The E-Series defibrillator is capable of analyzing your patient's ECG to identify if a shockable rhythm exists.
Stand clear.
The E-Series AED is capable of analyzing the patient's ECG rhythm in 2 different ways. The first is the always active mode that is running in the background of the semi-automatic mode, continuous analysis, when the multifunction electrode pads or the ECG cable and electrodes are in use. The second is in the user-activated mode, initiated by pressing the Analyze button. The user-activated analysis can only be done when the multifunction electrode pads are connected and firmly attached to the patient, and when the selector switch is turned to on. The E-Series AED with manual override option can be configured to automatically analyze on power up.
Stand clear.
It will then automatically charge if a shockable rhythm is detected.
Press shock.
You will need to press the shock button to deliver the shock to the patient. To use the E-Series AED model in the semi-automatic mode, verify the patient is unconscious, not breathing, and has no pulse. Call for help, begin CPR, and remove clothing covering the patient's chest. Depending on your system protocols, you may choose to initiate CPR before attaching the E-Series to a patient when encountering an unwitnessed arrest. If not pre-connected, attach the multifunction electrode pads to the multifunction cable. Apply the multifunction electrode pads according to directions on the package. Pads may be applied in the anterior, posterior, or apex sternum positions. Ensure that the multifunction electrode pads are making good contact with the patient's skin and are not covering any part of the ECG electrodes. To use the AED feature, the selector switch must be turned to on. The E-Series unit will beep 4 times to indicate that it has passed the power on self-test.
Stand clear.
If the audio recorder is present, the unit will begin recording audio data. Press the manual mode soft key on the front panel of the E-Series to enter the manual mode of operation. If the confirm soft key is not pressed within 5 seconds, the unit will revert to semi-automatic operation. If your E-Series has been configured to require an access code, enter access code will be displayed. You need to enter a 3-digit access code by pressing the soft keys corresponding to the correct digits. On power up, the message and voice prompt "Attach pads" will be issued.
Attach pads.
If ECG electrodes
Press Analyze.
or multifunction electrode pads have not been attached to the patient. If the pads become detached or the connection is broken, a "Check Pads" message
Check pads.
and voice prompt will be issued. If multifunction electrode pads have not been properly connected to the patient, a "Check Pads" message, alternating with a "Poor Pad Contact" message, will be displayed, and analysis will be inhibited. Press the Analyze button to begin the analysis of the patient's ECG rhythm. A Stand Clear message and voice prompt will be issued.
Stand clear.
The analyzing ECG message is then displayed while the patient's ECG is analyzed.
Press shock.
Warn all people standing near the patient to stand clear.
Stand clear.
No one should touch the patient, bed, or any equipment connected to the patient during defibrillation. A severe shock can result. When analysis is complete, the unit indicates whether or not a shock is advised.
No shock advised.
When a non-shockable rhythm is detected, the "No Shock Advised" message and voice prompt is issued. Immediately check the patient's pulse and breathing and resume treatment according to your protocols. If so configured, the defibrillator will automatically begin charging to the pre-selected energy setting and display a charging message. If the patient's rhythm is shockable, the unit will display a Shock Advised message. When the unit is charged and ready, the shock button will illuminate and the Press Shock message and voice prompt will be issued.
Press shock.
On the AED version, a continuous tone will sound for 10 seconds, followed by an intermittent beeping for 5 seconds. The shock must be delivered within this 15-second interval, or the defibrillator will disarm. On the manual version, a continuous tone will sound for 50 seconds, followed by an intermittent beeping for 10 seconds. The shock must be delivered within the 60-second interval, or the defibrillator will disarm. Press and hold the shock button on the front panel until the energy is delivered to the patient. Observe the patient and the ECG response to make certain the shock has been delivered. After the shock has been delivered, and depending on the configuration, The E-Series display will either return to the energy selected or will escalate to the next energy setting. Press the Analyze button to restart the ECG analysis and to determine if additional shocks are required. The unit uses both audio and visual prompts to present critical information to users. Please consult your E-Series Operator's Guide for detailed information on voice prompts and operating messages, which can occur during semi-automatic operation. If your device has been custom configured, some information may be different. Protocol Assist code markers can be configured to the specific protocols of your EMS agency. Separate code marker lists are available for defib, monitor, and pace modes. When you press the code marker button on the front panel of the E-Series, the unit displays a pre-configured list of clinical actions. The scroll keys on the top of the unit are used to scroll through the available markers. To record the intervention, press the Commit key on the top of the E-Series or the Enter soft key. The Protocol Assist code markers feature retains the last code marker in memory. When the code marker menu is opened, the cursor will automatically highlight the next item in the list. If the list of code markers has been configured to your protocol, you can quickly enter the highlighted clinical action without having to scroll through the complete list. This will record the actions and will provide the date and timestamps in the summary report. All E-Series defibrillators are equipped with an internal GPS clock to assure accurate times whenever the device is used. Placing the device outdoors when performing the GPS synchronization is recommended. To manually access the setting for GPS, press and hold the leftmost soft key, while turning the selector switch to Monitor, on for AED models. When the System Utilities screen appears on the monitor, release the soft key. Press the Clock Sync soft key, then press the GPS Timeset soft key to display the GPS clock synchronization screen. When the GPS time has been acquired, the display will show the acquired date, time, and day, and the number of seconds needed to sync the clock. Press the Return soft key to store the acquired time and return to the main screen. GPS synchronization works automatically whenever the E-Series has a direct line of sight to the GPS satellites. If the internal clock has not been set within the last 2 weeks, the message Time Synchronization Required will appear when the E-Series is switched off. E-Series defibrillators use a demand pacemaker option. To use the pacing option, apply ECG electrodes and the multifunction electrode pads to the patient and turn the selector switch to Pacer. Set the pacer rate to a value that is approximately 10 to 20 pulses per minute higher than the patient's intrinsic rate. The pacer increases or decreases by 2 pulses per minute on the display when you turn the knob. Increase the pacer output milliamps until you see capture when the heart is being paced by the unit rather than the patient's own pacemaker. Capture is indicated by a downward spike on the E-Series display. When the E-Series is switched out of pacer mode into either defib or monitor mode for less than 10 minutes, and then switched back to pacer mode, the pacer settings will remain unchanged. You can check your patient's underlying rhythm by pressing and holding the 4-to-1 button. This button suppresses 3 out of 4 paced beats. If ECG electrodes are not available, or there is something that interferes with the surface ECG, you can operate the pacemaker asynchronously. You should only do this in emergency situations when there are no other alternatives. Press the Async Pacing On-Off key. The E-Series display will show the Async Pace message. This is also printed on the strip chart when activated by the Recorder button. To return to demand pacing, press the Async Pacing On-Off key again, and the display returns to pace. Non-invasive pediatric pacing is performed similar to adult pacing, but uses smaller-sized pediatric electrodes. E-Series defibrillators use Masimo's patented SET pulse oximetry technology, providing superior performance in both motion and high ambient light environments. This also provides good results when used on poorly perfused patients. To use the SpO2 option, the SpO2 patient cable plugs into the blue port connector on the rear of the E-Series defibrillator. The SpO2 sensor should be connected to the SpO2 patient cable. Attach the sensor to your patient. Choose a patient site that is well perfused and restricts a conscious patient's movements the least. When using a disposable sensor, it should be placed according to the instructions on the package. Turn the E-Series selector switch to Monitor for advisory and manual devices. A dashed line will be displayed in the SpO2 field until the patient pulse is detected. Once the measurement has been established, the saturation values will be displayed in the numeric field box. If ECG leads are not attached, your patient's pulse rate measured by the SpO2 sensor will be displayed as the heart rate in the ECG field, and the heart symbol does not flash. The E-Series can display one or two waveforms in monitor, defib, or AED mode as long as it is not charging or ECG analysis is not in progress. With SpO2, the unit can display the pleth waveform below the ECG trace for a visual indicator. From the monitoring menu, press the Wave 2 soft key to cycle the display on the E-Series. E-Series defibrillators equipped with 12-lead ECG capabilities provide simultaneous acquisition, storage, display, and ECG analysis using the GE Medical Systems 12SL ECG analysis program. Transmission to a fax machine is available, as well as direct transmission to the GE Medical Muse system. With the integrated Bluetooth option, you can transmit your patient's 12-lead ECG to a fax or email destination via ZOLL RescueNet code review. Or you can use the Bluetooth pod to send the 12-lead to a fax machine. The 12-lead ECG cable should be attached to the cable connector in the rear of the E-Series. This cable comprises the 4 limb leads and 6 chest leads. Care should be taken to properly prep your patient's skin. This should include clipping excessive hair and light abrasion of the skin to ensure proper electrode contact. High-quality silver chloride electrodes should be attached to the ECG cable snap connectors and should be placed on your patient's well-prepped skin. When the V-leads are not in use, you must plug the protective cap into the V-lead connector block on the one-step patient cable. When the V-leads are required, remove the protective cap from the connector block and attach the V-lead cable securely into the one-step patient cable slot. Turn the selector switch to Monitor. If a PADS or paddles message is displayed, select a lead. You must select a lead to obtain the 12-lead ECG report. To print a 12-lead report only, press and hold the Recorder button for 3 seconds. A 4x3 12-lead report without interpretation will be printed. When the 12-lead soft key is pressed, the following soft keys will be displayed: Acquire, Settings, Patient Info, Alarms, and Return. Pressing the Acquire soft key begins the 12-lead acquisition process. The acquiring ECG message will be displayed, and the Acquire soft key changes to Halt. The 12-lead ECG interpretation and measurements will print if configured to do so. The Halt soft key can be pressed at any time to abort the 12-lead process. When the Halt soft key is pressed, the acquisition halted message is displayed, and the leftmost soft key changes back to Acquire. If one or more of the V-leads are not properly attached to the patient, an ECG V-lead off message is displayed on the screen. This indicates which lead is not attached. When the analysis is done, the message Analysis Complete is displayed. The E-Series changes to the transmission screen if it has been configured to auto-transmit after 12-lead analysis. Pressing the Patient Info soft keys allows access to the patient demographic information. You can select from ID number, age, gender, patient record, or return. Press the ID number soft key to access the name and the ID number screen. The cursor goes directly to the patient name field. Use the scroll keys on top of the E-Series to select a character on the keypad, and then press the Commit key to enter. When you have entered the patient name, select the Patient ID number soft key. The patient ID number is entered in the same manner as the patient name. Pressing the Return soft key takes you back to the patient information screen. Pressing the Age soft key allows you to enter the patient's age. Press the Return soft key to save the highlighted age and return to the patient information screen. If no patient information is entered, the default age of 60 and the default gender of male will be displayed on the 12-lead ECG report. For patients younger than 41, you must enter the patient's age. This is important as the 12SL analysis program contains age-specific criteria. For patients 15 years or younger, the 12SL algorithm performs a pediatric analysis. If you do not enter a patient ID, the E-Series assigns a unique ID number based on time, date, and year. The patient record soft key allows you to transmit or print specific 12-lead ECG records as denoted by the date, time, and patient ID number. Up to 40 patient 12-lead ECG records can be stored on the internal memory of the E-Series. Print record prints the selected 12-lead records on the strip chart. Print all prints all stored 12-lead records on the strip chart. Transmit transmits the selected 12-lead record. Return. The unit exits the patient record screen and returns you to the patient information screen. Your E-Series may be equipped with a Respironics mainstream or sidestream ETCO2 option. This option continuously measures carbon dioxide and respiratory rate using a unique solid-state sensor or module called the Capnostat 5. The Capnostat 5 CO2 mainstream sensor or sidestream module plugs into the yellow CO2 connector port on the rear of the E-Series. For mainstream use, select an airway adapter based on your patient's size, ET tube diameter, or monitoring situation. Attach the airway adapter to the Capnostat 5 mainstream CO2 sensor by aligning the arrow on the airway adapter with the arrow on the bottom of the sensor. Then press both the sensor and the airway adapter together until they click. For sidestream use, select an appropriate patient cannula and plug into the connector on the Capno 5 sidestream module. The E-Series is the only defibrillator able to offer both mainstream and sidestream interchangeable options on one device. Turn the E-Series unit to Monitor, on for AED units. The E-Series will display a warm-up message for approximately 1 minute. The message will disappear when the Capnostat 5 is ready to be used. Warm-up times will vary with the ambient temperature of the sensor, but usually takes less than 60 seconds. Should patient measurement be needed during the warm-up period, the ETCO2 waveform is available on the display. Zeroing should be done the first time a particular Capnostat 5 sensor or module is attached to the E-Series, or when changing between reusable and disposable adapters. In order to zero the sensor, press the parameter soft key. Select the ETCO2 menu item, then press Enter. Press the Zero soft key. The E-Series zeroes the adapter and displays the Zeroing CO2 adapter message for 15 to 20 seconds. The unit displays the Zero Done message on the display when complete. Pressing the Disable ETCO2 soft key puts the sensor into the power saving mode. Pressing the Enable ETCO2 soft key takes the sensor out of sleep mode and turns the heater on for normal operation. The Compensation soft key provides compensation for elevated levels of oxygen, 60% or greater, and for the presence of nitrous oxide, or both. Pressing the Comp soft key scrolls the highlight bar through the different types of compensation available, either none, O2, N2O, or both O2 and N2O. To display the second waveform, press the Wave 2 soft key. Pressing the Wave 2 soft key will toggle the display between ETCO2 and SpO2 and then off. E-Series equipped with non-invasive blood pressure allows you to take a single blood pressure measurement, stat measurements automatically repeated over a 5-minute period, or automatic measurements at pre-selected intervals. Blood pressure information including your patient's systolic, diastolic, and mean blood pressure values is shown on the monitor in the NIBP display area. To take a non-invasive blood pressure measurement, connect the NIBP hose to the port on the rear of the unit and connect the BP cuff to the hose. The NIBP button on the front panel of the E-Series allows you to initiate and terminate BP measurements. Now apply the BP cuff to your patient. From the main monitoring menu, press the Parameter soft key to access the Physiological Monitoring Parameter menu. When NIBP is highlighted, press Enter. Press the soft key and the following will be displayed: NIBP Stat, NIBP Auto, Cuff Inflation, Auto Interval, and Return. The front panel NIBP button can be configured to start in either Auto or Stat mode. NIBP Stat allows you to take up to 10 BP readings within a 5-minute period. NIBP Auto allows you to take automatic NIBP measurements at preset intervals. These intervals can be set between 2.5 and 120 minutes. The settings can be easily changed by pressing the Auto Interval soft key and pressing the Increase or Decrease soft keys to adjust the settings. Before taking a measurement, check that the initial cuff inflation pressure is appropriate for your patient. The default cuff inflation pressure is 180 millimeters of mercury. To adjust the inflation pressure, press the cuff inflation soft key, and then press the Increase or Decrease keys. If the Auto Adjust feature is set to off, the selected cuff inflation pressure will be used for all measurements. If the Auto Adjust feature is set to on, the selected cuff inflation pressure is used for only that first measurement. After that first measurement, the cuff inflation pressure automatically adjusts to 30 millimeters of mercury greater than the systolic value of the previous measurement. To take a single measurement, press the NIBP button. The cuff inflation bar reflects the status of the cuff inflation pressure. This cycle takes approximately 30 seconds. The E-Series will not start a new measurement unless 10 seconds have elapsed since the end of the previous completed measurement cycle. To take an automatic measurement, first select the appropriate interval. Then press the NIBP Auto soft key or press and hold the button on the front panel. To stop the process, press the NIBP button. If after 180 seconds the unit has not been able to determine systolic, diastolic, or mean pressure, it aborts the measurement and deflates the cuff. After each measurement, the NIBP display area displays systolic, diastolic, and mean blood pressure values. The Summary Report function allows you to store and retrieve ECG and device event information. The internal device memory automatically records defibrillation and cardioversion segments, heart rate alarm, and ECG segments. With Pace option, it will also store Pacer mode. Associated event information such as device settings, patient ECG, time and date, and code markers are also recorded. The Summary Report records each event in chronological order and stores up to 250 defibrillator or 210 recorder-activated ECG events. The Summary Report can be configured for automatic erasure after power off with selection values of 5, 15, 30, 90 minutes, 6 hours, 12 hours, 18 hours, and 1.5 days. The Summary Report can also be erased manually at any time. To print the stored information, press the Summary button below the E-Series screen display. Then press the soft key to print a selected call, print chart, or print log. To stop printing a report, press the Recorder button or turn off the unit. To print out a portion of the Summary Report, press the Summary button, then press the Print Chart soft key and then the Print Range soft key. Use the scroll keys on top of the E-Series unit to scroll through the list of events. Press the Commit key or the Print Record soft key to print the specified event and all subsequent events. The E-Series offers a selection of PCM-CIA data cards, 2, 4, 16, and 32 megabytes for recording all device information. You can store up to 2 hours of incident data, ECG and unit status, or 38 minutes of incident data and audio on one 4 megabyte card. ZOLL E-Series data can be uploaded to a PC or a handheld device via 2 transmission methods. Either using the RS-232 cable attached to the RS-232 port or the integrated Bluetooth wireless option. On the PC, you can use ZOLL's RescueNet code review as your receiving software. For additional detailed information on the operation of your E-Series, contact your ZOLL representative or ZOLL technical support.